Hey everyone, this is Victor here from Cyborg for Life. Today I have another very special interview for you. He's a world-class orthopedic surgeon specializing in limb lengthening and bone reconstruction. He's also the founder of the Bone and Reconstruction Center in Athens, Greece. Please enjoy the interview with Dr. Dimitrios Giotikas. All right, everyone. Today we have a very special guest joining us. He is a world-class orthopedic and trauma surgeon specializing in limb lengthening and bone reconstruction, and the founder of the Athens Bone and Joint Reconstruction Center in Athens, Greece. With a keen expertise to handle the most complex conditions, there's an important word that draws patients from all over the world to him: care. Please join me in welcoming Dr. Dimitrios Giotikas. Hey, Dr. DG, how are you doing today?
Hi, Victor. I'm very good. Thank you. Thank you for inviting me.
Yeah, thank you for coming on to the show, as I know a lot of viewers are going to be interested in hearing what you have to say. Now, your outstanding credentials are very impressive, and anyone who's looking into limb lengthening, knee replacements, or other complex bone conditions would feel completely content in your care. And with so many positive testimonials floating around from your past patients, it's no wonder that many of them praise you to be the surgeon who takes safety and care to another level. So with all that said, I just want to get a brief background on how you got your start in limb lengthening and eventually went on to establish the BJR Center in Athens, Greece.
Well, I started my career as medical career officer of the Greek army. So I was always focused on trauma, orthopedic trauma injuries, and the sequela of it. Later on, I was deployed in Afghanistan in 2009 as member of a multinational mission of NATO.
Okay.
And at that time, I got exposed and I treated many young men, young soldiers with severe injuries because of, explosive devices.
Mm-hmm.
And although we only did damage control surgery there and we sent them back to base hospitals for their further management, it got me into thinking about the further management.
Mm-hmm.
And I came to realize how, creative and useful limb reconstruction techniques like distraction osteogenesis can be for these young active men with the whole life in front of them.
Wow.
So this is, I guess, how I developed an interest in limb reconstruction and distraction osteogenesis. And then I found myself a couple of years later in the UK, in the United Kingdom, to learn more about this. And I worked for 5 years in Underwood Hospital, which is part of Cambridge University Hospitals Trust, one of the biggest and flagship trauma centers in the British National Health Service. And I had the opportunity to work and get involved in many cases of severe lower limb trauma, open fractures with a lot of soft tissue damage, infections, deformities after injuries. And we treated all this with frames and limb lengthening or bone transport, distraction osteogenesis in general. And this is how I got this experience that I have in limb reconstruction.
That's amazing.
I found it very fascinating, the fact that distraction osteogenesis basically is the ability that we have to harness a natural process, which is the healing response of the bone, and guide it towards the direction that we want for the benefit of our patients. I find this very fascinating, and this is the pleasure that I get from being involved with limb reconstruction.
Right.
So after Cambridge, I went to Oxford. I worked at John Radcliffe Hospital in Oxford, United Kingdom again, which is another, actually it's the oldest and one of the biggest trauma centers in the national health system in Britain as well. And at some point, I decided that I would like to transfer this experience in limb reconstruction and limb lengthening to the private sector, to my private practice.
I gotcha.
And it was at that time when I thought that this service is kind of very specialized service. And my vision was to offer it to not only the people in the UK, but to as many patients internationally as possible. And with that in mind, I set out to set it in Athens for very specific reasons, which were, that Athens and Greece is a very strong brand name as a travel destination.
Right.
Greek people and Greek professionals of all sorts have this sense of hospitality almost engraved in their DNA since many years ago. most importantly, hospital and other healthcare facilities are very contemporary in Greece, very high standards, abiding to European regulations. The hospital staff, the nursing staff are very switched on, something that I didn't see to such a degree in the UK. The value for money ratio could be very, very beneficial, very good value for money ratio for the service we provide. So for all these reasons, Greece has been and still is member of the European Union. So this makes it easier for people to travel from all over the world. And this gets particularly important in these days with COVID-19.
Yeah.
So for all these reasons, I decided to set up my private clinic in Athens and, offer the services to everyone from all over the world that would like to come to Athens to have their specialized treatment.
That's
in
amazing.
our center.
Wow. So from the military to Cambridge to Oxford to Athens, I mean, you have a long and very interesting journey there to get into limb lengthening.
They're all very beautiful places, aren't they?
Yeah. I see that. You probably like to travel too. So that's very cool. Awesome. So that's really cool. So now, like you said, you established the Bone and Joint Reconstruction Center in Athens, Greece. And I was reading some very interesting research that you're involved in there, stuff like functional recovery post-operation of limb lengthening, as well as body limb proportion analysis. Would you be able to go into a little bit more detail or elaborate on those topics at all?
Yes. Well, I'm of the opinion that even a frontline surgeon, as I like to think of myself, has the duty to be able to share their experience, to share their knowledge, their observations from their everyday clinical practice in a proper and scientific way, through research and through publications, through presenting their data, etc. Also, I believe that every physician should be in a position to be able to investigate properly any observations, any ideas, or any patterns that come up through the daily practice and the daily encounter with patients.
Right.
And with that in mind, I set out to find the answers to the questions that we didn't know. For example, as my cosmetic limb lengthening percentage of patients increased in my practice, one common pattern that I realized was about their concerns about their body proportions and how they were going to change after limb lengthening.
Right.
And we didn't have proper answers to give. Of course, we knew what was the average ratio between the thigh and the tibia. But what we needed to know was not just the average, but also the range of the natural human body proportions. How short-legged can someone be in relation to their torso without being, out of natural proportions? And with that in mind, I was scratching my head trying to find solutions, and we basically needed a large anthropometric study with measurements of the human body dimensions. And I managed to find this data from the United States Army. They did a large survey in their military staff for their own purposes, which were, designing workstations for their vehicles or designing equipment like headphones. So they need to know the body dimensions.
Okay.
I asked if they could provide me the raw data of their measurements, and they very kindly did. And from that, I calculated the proportions which were of interest for my purposes. Right. So leg to torso, thigh to shin, upper arm with compared to lower limb, arm span to height, and I was able to calculate the natural range of human body proportions.
Oh wow!
So now we're in a position that we can say to everyone who's interested that look, your body proportions now are at this position in relation to average, in relation to the range, and with lengthening we can move you up to there, and we can confirm that you are still going to be within the natural range of human body proportions.
That is so.
And this is important not only for cosmetic limb lengthening, but this is also important for cases of dwarfism, achondroplasia, in other words,
Mhm.
where we start the lengthening process from childhood, from the age of 8, and we do repetitive lengthenings in the lower limbs and the upper limbs every couple of years or so.
Wow.
So these little patients start being disproportionate because of their condition. So we needed to have a guidance about what lengths we should aim for in order to finally give them a more proportionate appearance.
That is mind-blowing, because will I look normal after the procedure? And you, who are actually performing legitimate research on this, can help ease their concerns and kind of confirm their their speculation.
Well, we must understand that we cannot do cosmetic lip lengthening without deviating away from the average proportions.
Right.
The great question is, how much away can we deviate without starting looking abnormal or without falling out of the natural range?
I see.
That's the big question that we can now answer. And I have presented this study in 2 occasions, in the British Lip Reconstruction Society and last year in Surgeons Invasive annual meeting, and I got very good feedback from my colleagues, and I'm really proud for this research. The next question that I think that we need to answer for the benefit of our patients is about the functional recovery of cosmetic lip lengthening.
Yeah.
There is not enough evidence. There is not a lot of evidence published in the literature about. I wouldn't say cosmetic. I would say bilateral lip lengthening.
Okay.
Femur orthopedic. And now, with the introduction of stride, we have started the protocol of prospectively collecting clinical data, range of movement, muscle strength, some functional scores, in order to monitor where the patients started from in terms of their function, in terms of the level of their activity, and how did they lose it temporarily during the procedure, and how and when and up to what degree they eventually got it back.
Okay.
And I hope that once we have enough numbers, hopefully next year, we will be able to be the first center in the world to publish sound evidence about the performance of stride.
They're into sports, they're into weight training, athletics of some sort. And, when they have this done, they're always worried, can they, get back to what they did? And you doing research on this, and hopefully in the next year, you said, or so, we'll have actual clinical data on this. Again, will ease concerns. So what you're doing behind the scenes, not only you helping patients achieve their stature length desires, but you're actually providing clinical research that can, innovate the industry as a whole. So my hat is off to you. That's amazing, amazing work.
This knowledge makes other doctors all over the world more accountable to what they promise, what they claim.
Wow. Yeah. And that's what I think is going to be good, because not only do you have an amazing, background and experience in all of this, but new doctors, as they come in the orthopedic field, who are, just touching the surface of limb lengthening now, you're going to have established research that they can use to help their patients as well. So a true innovator of the field, Dr. DG.
That's so true. What you said was so true, because I think that the greater scheme of things, in the way I see them, is that in the field of limb lengthening and limb reconstruction, we had the first generation, which was basically Professor Elizarov in the former Soviet Union, who invented and discovered the principle of disfractionogenesis.
Right.
Then we had the second generation of surgeons, the generation of George Pally, who brought this principle and this method from Soviet Union to the West initially, and then the United States, and published their experience and developed techniques, and they gave us the internal method, and namely the stride.
Right.
And now, as this generation is gradually retiring, it's my generation who will basically expand the knowledge in internal devices, and it's our duty to expand proper scientific knowledge through research for the benefit of the patients, because limb lengthening and limb reconstruction is expected to become more easily and more readily available across the world, because it seems easier now.
Yeah.
So we have the duty to provide and secure and establish standards worldwide
So now I want to go ahead and dive into a little bit more detail about the actual limb lengthening that you do at the BJR in Athens. So many interesting topics that flurry around the mind of potential limb lengthening patients. Things like, if they're considering to get it done, things like the cost of the procedure. Do you mind explaining a bit of your policies and fees on the costs at Athens BJR currently?
Well, there is nothing much to explain, I guess, because our price list is published on our website.
Okay.
And it's pretty clear what the treatment packages include.
Okay.
And one of my principles of practicing medicine is to always try and strive to make the service and the treatment affordable to as many as possible.
Okay.
It's one of my principles. And with that in mind, I always negotiate with myself and always try to maintain and as much as possible affordable price for all of my services.
That's sensible. That's fair. Okay.
And the second thing that I always take into consideration is when we need to increase or change for that matter our price list, we always give 1 or 2 months notice.
Okay.
So that we give us to people who are already in the process of coming to Athens not to change their plans, their financial arrangement.
I see. So you make sure that they know.
It's only fair to have as much transparency in the financial relationship.
I see. Okay. And now we're going to go into like when you actually start to have consultation with the patients for limb lengthening. Do you ever decide when you're sitting down with your patients what their max recommended lengthening goal should be for each patient, or do you kind of take into account certain factors like the muscle flexibility, or do you just set strict limits on the max length they can lengthen for each given limb length? So the femur's a certain length or the tibia's a certain length, or do you say it depends on the person?
Well, I would say the latter. I don't have strict limits because I don't believe that the words like always and never have a place in practicing medicine.
Mm-hmm.
What we practically do is that if the patient has a strong idea about what they want, we always try to respect it, because I'm of the opinion that all of us have the best understanding and perception of our body,
Right.
of our body image, and of our desires about it.
Okay.
So I think that this has to be respected when possible and when safe, obviously. So that's one parameter.
Mm-hmm.
With that in mind, the second parameter obviously is the limitation of the implant. So we know, for example, that with stride we cannot go more than 80 centimeters anyway. And the third parameter, and this is where the discussion really starts, is about the muscle length reserve and the body proportion. Muscle length reserve, in simple lay terms, is the length that the muscle can be stretched from the relaxed position before it starts restricting and hindering the full range of movement of the adjacent joint.
Okay.
For example, we have the hamstrings at the back of our thigh. Okay, and if we stretch them too much, they will stop allowing the knee to fully extend.
Okay.
Okay, so this muscle length reserve is different from people to people, from patient to patient, and it's something that we assess before the surgery with clinical examination. And we can pretty accurately predict if the desired lengthening goal is easily achievable or not. And we can then accordingly either advise our patient to have more physiotherapy or try to educate them and manage their expectations and, come into terms with something shorter than what they expected. Or we can even consider under special circumstances some soft tissue procedures to help muscles. Or we may decide or keep in our mind the possibility of going a bit slower with the lengthening in order to give the muscle the chance to catch up a bit with the lengthening. So we have some options to discuss.
I see.
And it's always important to know from the beginning how much muscle length reserve we have in relation to the lengthening goal that we're going for.
Okay.
And the last parameter is body proportions, as we discussed earlier.
Right.
And I would say there's a fourth parameter that I sometimes consider in very special circumstances, and it has to do with the lifestyle and the special conditions and special circumstances in someone's life. So, for example, if someone is really, really short, or, for example, is a short transgender woman who wants to become a man, and they cannot afford a 4-second lengthening to become taller and start looking like a man.
Right.
And they don't have a lot of functional demands. I could, under very special circumstances, discuss with them a bit extra lengthening in the tibia combined with a very mild and modified and automatic gastro-recession. I do it in a modified way to prevent loss of a lot of strength.
Right. Okay.
So, although I routinely avoid these things, I always see the patient that I have in front of me and try to get into their shoes and make the best decision according to their personal needs and desires and circumstances.
I see. So yeah, you take the patient's personal desires, but you also blend it with your own experience and safety knowledge to make sure that, you know, they have enough muscle length flexibility, because if they over lengthen, they're going to lose some, you know, activity in that.
Well, my motto is that science applies the same to all people, but each one of us suffers in a different way.
I love
so
that.
It's the doctor's job to know and have a very good grasp of the available knowledge and data, and then find the best way to apply all this knowledge and all this data and all this information to the one and only individual that's standing in front of them in this moment.
Yeah, everybody's individual. There's no one shoe fits all in this case, especially for limb lengthening. Very cool. Okay, so a lot of people I get a question a lot that you mentioned this. You said that sometimes you could distract a little slower to let the muscle catch up, but a lot of people are also worried about, you know, things like nerve damage or vessel damage. Do you ever run into concerns or type of complications with your patients, if any at all, or what type of complications do you see in the procedure?
Well, I would say to start from what you asked specifically, nerve damage during lengthening is not something very often, not something very common.
Okay.
A lot of things can go wrong. And I have had my own fair share of complications. Not so much with cosmetic cases, because cosmetic limb lengthening patients are kind towards the easiest end of the spectrum. They are young, they are healthy, they have no other injuries, they have very normal and untouched soft tissue envelope around the bones. I mean, the skin, the muscles, they're all normal and healthy, and they're compliant. But limb lengthening, for any reason, is a major orthopedic procedure, and many things can go wrong. Right. You have heard, obviously, about the risk of infection with any orthopedic operation. You have heard about the risk of blood clots in the veins, fat embolism has been reported, need for transfusion, implant failure, all this stuff, malunion, non-union. What I would like to say to you and your viewers is that if you sit down and see the rates of complications in limb lengthening, it's not that different compared to other commonly performed major orthopedic operations like knee replacement, hip replacement, fixation of broken bones. The rates of infections or thrombosis or blood clots is more or less the same. What makes a difference in patient's mind is the balancing of risks to benefits. Okay, so on one hand, you have the risks, and on the other hand, if you have something physical, like a physical pain, a physical dysfunction, which troubles you and doesn't let you to go back to your life, it's easy to make a decision and try to fix the problem. If the pain or the dysfunction is not physical, but it's psychological, okay, it's still pain, it's still suffering, but the balancing is more difficult, and probably requires more time for the decision to be made. So I would say that complications, I would say that limb lengthening is not a dangerous procedure per se.
In relation to other orthopedic procedures, it's nothing.
Exactly.
Yeah, I gotcha. Unless
but I think that it's worth discussing this. I think that it's the duty of the doctor to fully explain the possible risks.
Okay, that's cool.
So I regularly sit down with my patients and explain in great detail what could go wrong.
Right.
What measures do I take in order to minimize the risk of that happening, to prevent it? And what will I do if it happens? And I try to give them the full picture of what could go wrong. And I use this as a tool to filter out patients who are not ready yet.
Yeah, yeah. I like that you brought that up because a lot of people are so worried about this. I'm like, it's surgery. You're going to always have some sort of risk involved. And you being a surgeon who actually brings it to the forefront of the patient and says, hey, look, this could potentially occur. It's unlikely, but it could.
Questions are asked. The doctor has the responsibility and the duty to explain all this in detail and in lay terms so that the patient can then make an informed decision and give their informed consent to the procedure. It is a useful tool to filter out patients who are not ready for the procedure. And I would suggest to your viewers and to anyone who is considering limb lengthening to use this process also as a quality indicator for the center and the doctor. So ask your doctors about what could go wrong and listen to their answer. Is it an answer that makes sense? Is it an easy to understand answer? Does it make sense? Or if not, maybe you should ask more and more. But don't make a decision. Don't make any decision in relation to any medical treatment unless you feel confident that you understand every bit of it.
Oh, wow. For a patient who comes to you and gets limb lengthening, and obviously they usually recommend staying for the length of time, how often do you allow your patients to go back home, or do you prefer them to stay on site and receive their physical therapy at the BJR?
Well, ideally, I would prefer my patients to stay in Athens for the whole lengthening period, because I'd like to see them regularly every 2 weeks, to have x-rays every 2 weeks, confirm that the lengthening and the consolidation progresses as expected, make decisions if it doesn't, examine them, see how their flexibility and their strength progresses, all this stuff. So ideally, if the patient can afford to stay in Athens for the whole lengthening period, it's something that I generally endorse and encourage. But I do understand that it's not easy for all patients, especially now with the COVID-19 pandemic, it's even more stressful to be abroad.
Right.
Although I must say now that Greece has responded very well to the COVID pandemic. The Greek government took very proactive measures very early on. So we managed as a state to control the pandemic very, very quickly. We had only 145 deaths or so. So Greece is now becoming one of the safest places in the world to for holidays or for treatments for that matter, that we were making. So despite that, it is always a bit more stressful and a bit more difficult to receive treatment abroad, especially if you have a flare-up, if you have a new wave of pandemic. With that in mind, and also taking into consideration the other circumstances of basic life, in some cases we can allow them to return back to their countries under some conditions. So what I need to have secured in order to allow someone to go back to their countries, that they have a physiotherapist there, to whom I can talk and I can contact and give them instructions and be ready to accept their questions. So they need to have a physiotherapist there. They need to have an orthopedic surgeon or an orthopedic department nearby in case they need some medical advice. Which is not very likely, but it's a reasonable precaution to have. And the third prerequisite is that there must be a country where Nuvasive can provide support, technical support for the ERC device, the external remote control device, which sometimes may need reprogramming, or in any case, if there is a technical problem, I need to know that where my patient is, there is also available technical support for the device.
For the device, for the
So
lengthening.
obviously this third prerequisite applies only to lengthening with stride or precise, but you get the idea. I need some minimum safety conditions in order to secure safety and efficiency and smooth progression of lengthening.
Wow.
And from there on, we will have regular X-rays every 2 weeks that they will send to me with an email. I will see them. We will discuss. If I need to give instructions to the physiotherapist, and so on.
Okay, so those three reasons are okay. So you prefer them to stay in Athens, and like you said, it's probably one of the safest locations for surgical treatment right now, which is a really interesting thing because over here in the United States, it's crazy. But then, like you said, if they do have to go back home because they have a family or responsibilities, that they need to have a physical therapist who you can talk to, and an orthopedic surgeon who can administer care as well, that you can touch base with, and that NuVasive has to have support for the ERC device so that if anything goes wrong, they can prevent complications. That's
exactly important. Yes. This is something that I had in my mind since before the COVID problem occurs. But you can understand that the COVID pandemic accelerated developments because we found ourselves with some patients in Athens and the COVID pandemic spreading, and it was new to all of us. So I thought that we had to make quick decisions and try to evacuate our patients back to their countries. So what I had in my mind to develop slowly, I had to develop it a bit faster because of that.
Now, another major concern that a lot of people are always worried about, Dr. DG, is walking normally after, leg lengthening. So we know that, they have to get through the distraction phase, get their length, and they have to let the bone heal properly. What is the average time frame that you think most of your patients tend to get a normal walking gait back after, let's say, the 8 centimeters on the femurs? What do you typically see?
I typically see the lengthening period plus 6 to 8 weeks.
Okay. So 6 to 8 weeks.
We have the lengthening period. Where the bone keeps lengthening little by little, obviously, and the muscles are always trying to catch up with the new length, but they never manage to do so because muscles need more time. And once we finish lengthening, then we have to allow, depending on the degree of lengthening, 6 to 8 weeks, 1.5 to 2 months, for the muscles to adapt to the new length and strengthen a little. The most common problem that hinders normal walking pattern with femoral lengthening is gluteal muscle weakness.
Okay.
So patients tend to walk a little, in a wobbly way. But once we focus on that and strengthen with physiotherapy the gluteal muscles, this improves in the time period that I just mentioned. Okay.
So it's a real big thing is muscle, like you said, muscle reserve and muscle strength. So really the rebuilding, the rehab is probably as important as doing a proper distraction phase. Or equally as important.
Oh, no doubt. Definitely. I think that 50% of success of limb lengthening is the hard work of the patient after the surgery. The surgery itself, technically, it's not that difficult for most surgeons to put a nail in the bone is not difficult. Of course, there are differences. I don't underestimate it, and I have seen anyway. But yes, nailing a bone is not that difficult. The problem with limb lengthening comes from the dedication and the discipline that requires from the patient on a daily basis, for what seems to be a relatively long period, 3 months, 4 months. Okay. So my advice to everyone who is interested in limb lengthening is to be prepared for a lot of hard work. It's basically like a full-time job. Be ready to be dedicated and disciplined if they want to recover quickly.
I gotcha. Yeah, because it's no walk in the park, pun intended. They need to put in the work. And I think you said, like you mentioned, preparing ahead of time, thinking about weighing the possibilities. Are they a hard worker and willing to put in a rigorous 5 or 6 plus months into this procedure and this process, because if they want to come out on the other side successfully, they need to be able to do that.
Yes.
Okay. Very cool. Okay. So let's say that your patient.
Don't get. Let's clarify this a bit more.
Okay.
If someone is a bit lazier, if I'm allowed to use the term, if they're a bit more lazy,
Right.
it's not that they will necessarily end up with any major problem.
Mm-hmm.
It will just need more time until they realize that unless they work,
Mm-hmm.
they will not get back their function.
Okay. Okay. They got to put in the work.
So in other words, they were never ready for the procedure, and they have to mature through the process. Okay.
Yep. That makes sense.
Full-time job every day, day in, day out.
Yes, it is. It is. It's like if they have a full-time job on top of this, well, they got 2 full-time jobs now. So
exactly. Yes.
Okay. So you're finished consolidation with a said patient. This is, let's say, 6 months post-op, and they get their checkups. Their x-rays look good. The bone is healed really solid. Would you say that most of your patients are content and satisfied with their new height and their new quality of life after the leg lengthening surgery?
Yes, okay. I could say that.
Oh, that's awesome.
I usually ask them 1 month, 6 weeks after they have gone back to their countries after we have finished lengthening, and they are now more relaxed, and the function has recovered significantly. So I ask them, did it worth it? Now that you have gone through the whole process, the whole ordeal, did it worth it? And all of them say yes, of course. And then I challenge them a bit more and ask them, so would you do it again? And they all say yes, I will definitely do it again.
Right.
But it's not what they say, because they say things like, oh, I now talk to my sister or brother and our eyes are leveled.
Right.
Or the light switches are lower now, or the tables are lower. So they feel the difference in their relationships and in their environment. But it's more important how they say it. I can see that their face lights up and their eyes open, and they really happy. Yeah. So I believe that they really feel happy with the outcome. Yeah. But this is not enough for me. As a science, I would like to know in what percentage. So this, the measurement of the improvement of the dysphoria, which means the bad feelings about something.
Right.
It's part of the protocol that we have about recovery. So part of the protocol that we have to monitor recovery is that we have a questionnaire about dysphoria.
Yeah, I completely agree with you, and it's like the overall the journey of this process is what I think it builds character in a sense. Like when you're going through it, it's like you're climbing a mountain, and if you can make it to the top and you put in the work and the effort, and at the end you can tell that it was worth it if you were ready for the surgery, as you mentioned. So that's really cool that you put that perspective.
I totally agree that it builds character, and that you're not the same person in many ways, not only height-wise after the operation, but at the same time, let's clarify that it's not the best way to build your character.
Right. Yeah, don't. If you're feeling down in life, don't just go.
Don't decide that it's just to build character. Okay. And in all seriousness, I think that a good way to secure a satisfaction, a feeling of satisfaction after the surgery, is to relate it with a specific and measurable and realistic and meaningful and time-dependent goal that you have to achieve.
Okay.
For example, I will do limb lengthening because, and after that, I will be confident enough to get the promotion in my work that I so desire in the next year.
Right.
That's a measurable target, time-dependent next year. It's realistic. It has to be realistic. It's meaningful. So, or for example, I will get limb lengthening, and this will give me the confidence and the stature that I need in order to be able to flirt successfully this girl or this type of girls that I like.
I like that.
In 1 year.
Yeah.
So you have to have a measurable, realistic, meaningful, and time-dependent goal to relate to the limb lengthening.
I see.
Because if you do that, first of all, it will it will give you more focus, more determination during the lengthening process. And once you have achieved the goal, the related goal, if you manage to achieve it, you will immediately know that the surgery worth it.
Yeah. These people who want cosmetic limb lengthening, they connect the procedure to a benefit that they're going to see and improve quality of life. It makes the journey that much easier or worth it in the long run. That's really cool that you mentioned that. Okay. Okay, so Dr. DG, if anybody's interested in contacting you at the BJR, where can they reach you? I'll put your website in. Is that the best link for them to set up a consultation with you?
Yes.
Okay.
Yes, I think that our website and in the contact page they can have the contact details with email, with forms, or they have the option of booking a consultation with me, a free introductory consultation, a short one, just to get to have the opportunity to get to know each other. Okay. So there are some options there, and let's start with the website.
Okay, and you're doing Zoom consultations, virtual consultations as well, correct?
Yes.
Would there be any last words you would like to add to somebody who's considering, because now elective surgeries have reopened in the world, and a lot of people are, considering limb lengthening, a lot of them are. Would you have any last words for people besides just contemplating the risks and rewards that is considering limb lengthening at the moment?
Yes, I would like to give 2 pieces of advice to your viewers. One is about internet and limb lengthening. So this concerns you as well. Yeah. Internet is a fantastic tool. We can find a lot of information there. So my advice to prospective patients is to try to find as much information on the internet as possible, but always try to identify the type of the information that you find and treat it accordingly. Right. So is this what you find in the internet? Is it a scientific paper? Is it a published evidence? Treat it as such, as statistical sound evidence. Is it a personal experience of someone else, good or bad? Treat it as someone else's personal experience. Okay. Is it a promotional article or a promotional review of a medical tourism facilitator trying to bring patients to a specific center? Treat it as an advertisement. So internet is a fantastic tool, but you have to be vigilant and try to understand the value of the information that you find. And try not to get too fixated or make decisions about your body based on the internet only. Because all this information has to be matched with your personal condition and circumstances. And this can only be done through a consultation with a doctor. Right.
Yep. I completely agree. And that's why I say setting up consultations. And I wanted to bring on people like yourself so they can get legitimate and correct advice. So
the second piece of advice that I would like to give to the prospective patients is talk to 2 doctors. Don't just talk to one doctor. If you are prepared to travel half the globe to come to Athens or fly over America to go from the one coast to the other coast or whatever, don't hesitate to spend a few extra dollars or euros to have a second consultation with a second set. This may help you clarify things better. This will help you make the best decision about your safety, and at least it will give you more confidence in your decision.
Yes. Yeah, because you need to have that confidence in that decision, because this is a life-changing surgery, and you want to make sure that it's the right choice at the end of the day.
Yeah.
All right, everyone, that is Dr. Dimitrios Giotikas of the Athens Bone and Joint Reconstruction Center in Athens, Greece. Dr. DG, thank you so much for your time. And if anyone is interested in reaching out to him, I'll be sure to post his link to his website in the show notes. So please do that if you're interested. All right, Dr. DG, thank you so much. I'll talk to you later.
Thank you, Victor. It's been a pleasure. Goodbye.
Goodbye.
I hope you enjoyed that interview with Dr. DG. He's a truly amazing surgeon who takes safety and care to another level. If you're interested in setting up a consultation with him, you can see his website link in the show notes. Until next time, this is Victor from Cyborg for Life, signing out.